My specialty area is hematology oncology, which if you don't know what that means, it's cancer, blood cancer specific, and that's what I specialize in as a nurse in the civilian world. And that's all I know. That's what I've done since I graduated nursing school in 2007. And I work at the James Cancer Hospital at OSU. So what I do here is I'm the officer in charge of the CPR program, which is emergency resuscitation. So I manage all the instructors on base and make sure that they're teaching properly and make sure that they're all trained properly and that they maintain their training every 2 years. Coordinating with people, coordinating with members, making sure that every member on base that is required to have CPR in their mobility wallet has it and that they're current. And if they need it, I try to coordinate that with my instructors to make sure that if someone needs a class that they can get into a class. And by projecting 2-year schedules, we try to, well, at least with the med group as well, making sure that we're all current, because it's important for all the medical professionals here to stay current. If I were to backfill or go to an active duty base, I would be a nurse just like I am on the civilian side. I would be working on a med-surg floor or, in one of the active duty hospitals, I would be taking care of patients. So my path through the medical profession, I actually joined the wing before I became a nurse. So I joined right out of high school, and the path I wanted to take was to go to school to be a nurse, but in order to do that I needed some financial help. So I joined the wing and got my 100% college tuition, and after 6 years I decided that I wanted to stay in, that it was a lot of fun and there was tons of opportunities to travel and do really exciting things within the medical group. So with that, I continued until I graduated college, and then I waited 5 years until I applied for a nurse position here. And then once I became a nurse and learning how to be an officer, all that was new. And so now I'm, working on my nursing career in the Guard and hopefully staying in for a little while longer. So we'll see. Started as an enlisted. Yeah, I was enlisted and I was a medical technician, which gave me all the training I didn't have or, kind of needed for nursing school. So it taught me a lot and kind of helped me with a lot of hands-on things that nursing school hadn't even started teaching me yet. What has kept me in the military is pretty easy. It's the people that I work with. There's so many professionals here that that you become really close to, and they become like your family. And so you benefit from that because you can, you go on these annual training trips and you talk to them, you work alongside them. They can teach you so many things about medicine or especially the providers, the doctors. Now we have nurse practitioners and physician assistants, and we have a lot more women who are in those positions as well. And so you share that experience, and you're able to approach them. Everyone's very approachable, and so with that, I think I've learned and grown a lot. And you build those relationships, and that just keeps you from ever wanting to leave, because the minute you decide your career is complete or done, you wonder if you're going to lose those relationships. There's been a few unique experiences. I would say going to my first humanitarian trip was very unique, going to a place where we were offering eyeglasses to people who had they just didn't have the medical access to anything. So between, I would say, optometry and dental, it was very unique, because you were seeing people from a third world country who didn't have any dental care, and we were pulling their teeth out because they were just decayed and in a lot of pain. And the process was painful to watch, but once they were done, it was like we helped them in the long run overcome a health issue that they had no way of probably having done in their country. It was Belize, actually. And then giving them glasses, and helping them see, and also helping them get the right fit and the right maybe style of glasses that they felt comfortable in. And the language barrier, they couldn't speak English. A lot of them were speaking Spanish, so overcoming that and still being able to help them was really significant. So that was a unique experience, learning all those cultural things and then being able to help them medically. And then we also went to an Indian reservation in California, being able to see that, being able to work with people who reside on the Indian reservation, and offering them health care, because they're a lot of them don't have the access to health care, and helping them and seeing what their needs were and how their needs just weren't being met, or they were living in poverty, or and just it was a cultural thing too. It was just seeing a different culture right here in our country. So that was cool. That was a neat thing. That was unique. And I think those are my top two. We've also done guard care, which right here in Ohio, we've gone to Morrow County, other counties around Ohio, and completed that with the Army, and set up a clinic and had people from that county come, and we've drawn their blood, and if there was something wrong, we've referred them to the hospital nearby. But just giving them the access to healthcare, bringing immunizations to them on site, and giving them their immunizations, and everything was free. So that was how it was advertised, and that was how we got people to come out, getting their children all immunized, a lot of the teenagers needed their athletic physicals, so getting all that done was really cool to see, and just meet people in the community that are like right here in Ohio. So that was pretty unique. Currently, like right now as a nurse in the military, it's different. It's very different. In the military as a nurse, you're not really so much involved in patient care. You're more involved in managing a program. So you're managing a process and making sure that the process is working. And so it's more management, it's more leadership. Whereas civilian wise, I work on a floor taking care of patients with peers. So I'm independently working. I'm not managing anybody except my assignment, my patient, and I'm doing the work. I'm hands-on doing skills, working on, taking care of somebody, and so it's a lot different. And I miss that patient care part in the military. So when we go on these trips and we're in a active duty hospital, like we were just at Launch Stool in July or June last summer, and it was great because I was working as a nurse with patients. I was giving infusions. I was actually taking care of cancer patients, which is what I do civilian, and that was really cool because I was able to offer that. I was able to say, this is what I do on the outside, and I can do this with active duty. I can find my niche, and I can go right ahead and do it without any seamlessly. So in 2006, I deployed to Iraq, and when I was deployed to Iraq, I was enlisted. I was a medical technician, and it was at my 6-year mark. So I just, overview wise, I was part of an EMEDS. I was doing things I had never done before. I was driving an ambulance on a flight line. I was talking on radios. I mean, we trained for that kind of stuff, but we don't do that here in this clinic on a regular basis, so that was very intimidating and new for me. So I feel like I grew a lot from that. And I was taking care of, we were overseeing the prisoners of war. They were moving the prisoners of war, so we were doing a lot of medical health care with them, making sure they were healthy, taking care of them while they were in transition. And then there were a few Americans that we were taking care of as well. So my job is very important because it gives people the tools they need to provide CPR. So I want to make sure that they're getting trained properly. Otherwise, if they're in a real world situation, if they're deployed or anywhere in the world on any kind of mission, just knowing how to provide that level of care initially if something were to happen to somebody. Even on our base, I always stress with people to make sure that they are confident if somebody in maintenance were to fall out and have a heart attack. Do you know what to do? Would you be able to provide CPR to them effectively until someone with higher level of experience and skills could get there? Do you know the first thing to do? What are the steps? The AEDs on base, do you know where they are? Do you know how to use them? So for that, I take a lot of pride in just making sure that people are confident with that and that they feel good about using those tools. Now I have a family. A lot of things have changed over the course of my career. So learning how to advocate for yourself, and what I have to do is create balance, just like with anything. Taking that time for yourself, taking care of yourself, and then making sure that you're able to take care of your family, planning ahead, which is really important now that I have kids and a husband. They depend on me, so I have to plan ahead whenever I'm traveling. I have to make sure that I communicate well, and making sure that things are set up and lined up for them so that while I'm gone, they're taken care of and things are planned. Hi, my name is Captain Nicole Nicol from the 179th Medical Group, Mansfield, Ohio, and I would just like to give a shout out to all the women in the armed forces in honor of Women's History Month.